Okay, my name is Adrian Richards and today I'm going to be talking about a mastopexy augmentation procedure. So a mastopexy is known as a breast uplift and basically tightens the skin of the breast. An augmentation or enlargement increases the volume of the breast. Okay, so an augmentation is basically used to increase the size of the breast when the nipple has not descended. Okay, so in someone who hasn't had children or has had children but the nipple isn't too far descended, an augmentation alone will sometimes do. Someone who's got sufficient breast volume and just wants a slightly purter breast, an uplift will do. If you've got the dual combination of insufficient volume plus a nipple in a very low position, and the way you test this is if you look at yourself in the mirror, if there is no skin underneath the brown bit, the areola of the nipple, when you're looking straight on, you may well need an uplift because there should be normal skin underneath the nipple. Okay, so if you haven't got sufficient volume for an uplift mastopexy alone, or if you've got a significant amount of droop without the volume, the best option for you is a mastopexy augmentation. And in mastopexy augmentation, the volume is corrected with an implant and the lowered nipple position and droop is corrected with an uplift. Okay, so this operation incorporates elements of both the augmentation and the uplift. Okay, so I'll talk about the augmentation first. You need, as in normal breast augmentation, think very carefully about the size, shape and volume of the implant you're going to be using. And again, what we tend to do is spend a lot of time with you in different clothing, looking at implants in our special bras to see what volume suits your frame the best. So you need to think very carefully about the size of the implant. Next thing to do is to think very carefully again about the type of incision. With a breast augmentation, the normal incision is in the fold, 5 centimetres in the fold underneath the breast. With a mastopexy augmentation, the incisions have to be longer. They can, like a mastopexy, be just an incision, a semicircular incision on the upper part of the areola, can go right the way around the areola, can have a lollipop incision, or either a short transverse scar, which is a lollipop with a transverse scar, or a lollipop with a full transverse scar. But normally, because we're adding volume, we're tightening up the breast skin by adding volume, the amount of scars you need are generally shorter in a mastopexy augmentation than in a mastopexy alone, in which there's no added volume to the breast. So again, mastopexy augmentation, slightly more complicated than either an augmentation alone or a mastopexy alone, because the surgeon's got to juggle changes in volume and changes in the tissue tightness. Now, there is a debate in plastic surgery whether the mastopexy augment should be done at the same time, or whether some surgeons would favour doing a mastopexy, so doing one at a time, so doing the mastopexy, the uplift, getting the dimensions of the breast right, and then doing an augmentation. Some surgeons prefer to do the augmentation followed by a mastopexy. Most of my patients, I think, because of time concerns, prefer the combined approach, having a mastopexy augmentation at the same time, which has the advantage of one operation, but probably is technically slightly more difficult to get absolutely right. So again, I would suggest it might be worth listening to a podcast we've done talking to a patient who's had these procedures. Also have a look at the video we've previously done on augmentation and the video I've done on mastopexy, because mastopexy augmentation combines both of these. But the important things to think about in this form of surgery are volume of implant, shape of implant, location of implant, in front or behind the muscle, and these are all discussed in the breast augmentation videos. And with the mastopexy, type of mastopexy, type of scarring and extent of scarring, which again are discussed in the podcasts and also in the mastopexy video. So thank you very much.